Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 207 new cases of COVID-19. This brings our statewide total to 851 Pennsylvanians who have tested positive for COVID-19, now in 40 counties in Pennsylvania. Yesterday, we had 165 new cases, and today we have 207 new cases of COVID-19 in one day. Approximately 70 Pennsylvanians have required hospitalization since March 6th, when we first confirmed our first cases. This is about 10% of people who have tested positive for COVID-19. 8,643 Pennsylvanians have tested negative for COVID-19 to date. Tragically, we have had 7 Pennsylvanians die as a result of this virus. 2 in Allegheny County, 1 in Lackawanna County, 1 in Monroe County, 1 in Montgomery County, and 2 individuals in Northampton County. Unfortunately, we expect to see these numbers continue to increase each day, which underscores the need for all of us to stay home. This is an uncertain time for all of us, but Pennsylvanians are strong and resilient and are asking, what can I do to help? Well, there is an urgent request from blood donation centers, including the American Red Cross, for blood donations. As we prepare for a surge in hospitalizations, we know that blood donations are vital. Blood donation centers are taking proper precautions to protect anyone that is donating blood. Donations of platelets, blood, and plasma, all the different constituents of blood donations, are needed. Another way you can help is to donate to a local food bank. Many Pennsylvanians rely on food banks to feed their families. You can donate safely while practicing social distancing. Please contact your local food bank to find out how. The most important thing for Pennsylvanians to do is to stay home. If you don't have to go out, please don't go out. Now, here are my daily reminders. Wash your hands with soap and water for at least 20 seconds, the time it takes to sing happy birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and try not to touch your face, especially after touching surfaces. Clean surfaces frequently. Practicing these everyday prevention efforts can help slow the spread of the virus COVID-19. If you have questions about your health, please contact your healthcare provider. If you or someone that you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Dr. Levine. We're getting a lot of questions about the growth and the number of cases in Pennsylvania, about the exponential growth in Pennsylvania, and then also in terms of assorted variables like increased testing that might not be an apples-to-apples comparison. Mm-hmm. Is there roughly a percentage that we would regard as a significant turn of events in terms of upwards or downwards?
Well, we are continuing to see this exponential rise of cases, of new cases of COVID-19. And thus we are seeing a doubling of new cases approximately every 2 or at most 3 days. And so that is leading to the rapid increases that we're seeing. This is the same increase seen throughout the country that we're seeing in Pennsylvania. There is some variability in terms of testing and in terms of when test results come back, but that is really often the same each day. Sometimes we might get more test results back from a certain laboratory or less, but as it all evens out, we're still seeing that exponential rate increase. As long as we are seeing that, the virus is spreading in many communities, community spread, and it remains a public health crisis, an epidemic. It's a pandemic. And so the purpose of the governor's strategy, the mitigation strategy, the prevention strategy, is to try to prevent that peak, that big surge that could, in theory, overwhelm our healthcare system. And that is why the governor has closed the schools, why he has asked non-life-sustaining businesses to close, and why now we have a stay-at-home order for the counties of Philadelphia, the Collier counties, Monroe County, and Allegheny County.
Secretary, we're getting several reporters who are asking about the numbers of patients who have recovered from COVID-19. Could you address that, please?
We don't track patients who recover. We're certainly tracking the number of cases, the number of new cases. We track the number of hospitalizations, the number of intensive care unit admissions, the number of ventilator patients, patients that require artificial ventilation. But we don't track as patients recover.
And then we're getting a lot of questions about our hospital capacity. Pennsylvania has about 3,400 ICU beds, according to the latest figures. What are we doing to increase the number? Is there a target that we feel that we need to reach?
So we are working very carefully with our hospitals and health systems, with the healthcare coalitions in each agency, the Hospital Association, Pennsylvania Medical Society, and our county municipal health department partners to prepare for this surge. There are a number of different parameters that we have to watch. We have to make sure that we have enough space. So we have to make sure that we have the number of beds for the whole continuum of care, that we have ICU beds, that we have regular, what I call medical surgical beds, that we have post-acute beds. And so we're working with them. Hospitals can expand the number of beds without having to get permission from the Department of Health. We're working to repurpose ambulatory surgical facilities so that they can take care of less acute patients. We're actually even looking at hotels to take care of post-acute patients as they convalesce. So many different plans. This is in concert with the Department of Health, PEMA, and the local authorities, as we've been describing, as well as the hospitals and health systems. The other is staffing, making sure we have the medical personnel available to take care of these patients. We have to make sure we have enough supplies for patients, for physicians and other healthcare personnel to take care of these patients, such as personal protective equipment, the N95 masks that we've been discussing, ventilators, et cetera. And then there are what are called crisis standards of care that allow hospitals to deal with surges. So all of that is happening at the same time.
We have actually a couple of follow-up questions to that. From Penn Live, what's the status of converting hotels, conference centers, and other public spaces to medical sheltering facilities? What would be required to convert those spaces, and how quickly could that be accomplished?
So we are making those plans as we speak, especially in the hardest hit areas that we have been describing. There are actually some companies that we can contract with that could retrofit a hotel room to make it amenable for patient care. Again, these would be more for subacute patients, meaning they're not in their acute phase, more to kind of rest and recuperate and convalesce. And so we're working on those plans as we speak.
And then as another follow-up to that as well, what is the status of procuring ventilators and personal protective equipment? Previously, it was mentioned that a few PA manufacturers may begin doing that. And what of the other possibility, Army depots such as Letterkenny?
Hospitals and health systems have their stores of personal protective equipment, and they have the number of ventilators that we have been describing. The Department of Health has stores of N95 masks, other personal protective equipment, as well as ventilators. And then we are being replenished as we put those out by the federal government from their stores. In addition, many manufacturers have called that they might be able to make these masks or to sell ventilators at companies in Pennsylvania. So we are actually purchasing ventilators to increase our stores as we speak. We're working to purchase N95 masks that might be available, and then have some companies maybe repurpose some of their own manufacturing to produce N95 masks, as well as purchasing them from other states or even some other countries. So there's a full-out effort across the administration to make sure that we have the supplies for our healthcare personnel to deal with the surge of patients from COVID-19.
Secretary, from the Daily American, rural counties such as Somerset are now seeing their first positive COVID-19 cases. Do you expect rural areas to begin to see COVID-19 spread through these areas and possibly have to take stronger actions such as stay-in-place orders? Well,
we do expect to see the spread of COVID-19 to rural areas and really throughout Pennsylvania. We don't expect the numbers in rural areas that we are seeing in some of our largest urban areas, such as Philly, Pittsburgh, and the Collier counties, just because of the number of people who live there and the population density. But we do expect to see cases, and if necessary, the governor will take all precautions to try to prevent the spread of COVID-19. So we reevaluate that every day.
Secretary, from Spotlight, PA, patients who rely on drugs for the treatment of chronic conditions such as lupus are having trouble getting those specific medications due to pharmacy shortages after the president suggested that this drug could be used to treat COVID-19, even though it's not been clinically proven for this use. Are we considering following other states and restricting access to the drug, or taking other steps to ensure supply is available for those who need it?
So we're working with the pharmacists to try to make sure that patients who are using these medications for accepted FDA uses have access to that. So we've also discussed that with the Department of Human Services. So specifically, we're talking about the medicine chloroquine or hydroxychloroquine. Now, there has been some anecdotal evidence that might help with the treatment of COVID-19, but it is not an accepted standard of care. We're not recommending that physicians routinely prescribe that especially for outpatients or for prevention. There's no evidence for that. I mean, what it's really critical is that the right medicines be determined to treat COVID-19 at the right dose at the right time. All that will happen with clinical trials sponsored by NIH, the National Institute of Health. I know that for critically ill patients, some physicians expert physicians in hospitals, infectious disease experts, and intensive care physicians might be trying some experimental or investigational protocols for life-saving treatment, but for routine treatment, we're not recommending any specific medication besides, acetaminophen for fever and fluids and rest.
Dr. Levine, from ABC 27, can you touch on the mental health resources offered during the COVID-19 outbreak?
So we have been working with the Department of Human Services and the Office of Mental Health and Substance Abuse, as well as the Department of Drug and Alcohol programs, to make sure that patients have the mental health services they need during these extremely stressful times. In addition, there's the hotline that I've mentioned before, the texting hotline. So these are very difficult times, and it's normal and expected that people have emotional needs. We want to make sure that we meet those needs.
We have a question from WNEP. With New York City area seeing such a rapid increase in the number of coronavirus cases, is there any way to limit or restrict access of people from New York and New Jersey into Pennsylvania? He's saying that we have hundreds of commuters who take the bus into New York City every day.
There are no federal efforts or statewide efforts to prevent interstate commerce or to prevent interstate transportation. Not at this time.
And then a question from WFMZ about homelessness. Any suggestions for the homeless? We're hearing some warming stations have closed and they don't know where to go.
So there is a working group in the governor's administration working with communities such as Philadelphia and other large communities with significant homeless populations to work on the needs for the homeless. Staying at home is really difficult if you don't have a home. So we want to make sure that the homeless have resources and a place to shelter and that their needs are met.
We have some questions around testing. From WPXI, how long is it taking to turn around test results? We've heard some facilities saying it's taking as long as 5 to 10 days.
So there are a number of different ways that individuals can get tested. So at the Pennsylvania Department of Health, we are prioritizing our laboratory for healthcare personnel, for individuals that are in very vulnerable groups, for intensive care patients, things like that. So we have certain criteria for our laboratory. Many hospitals and health systems have their own testing being done there where they actually can obtain and then test it themselves. And then through the commercial laboratories, Quest and LabCorp, testing can be done as well. Our turnaround time at the Pennsylvania Department of Health is up to 24 hours. Hospitals and health systems have usually, if they're done in-house, have a turnaround time of approximately that. We have heard that the commercial laboratories have somewhat of a backlog and is taking a number of days to get results. We'll do anything we can to work with them to try to limit that.
We have a couple of questions on some of the statistics that you gave out a little bit earlier. First, is the state subtracting the number of deaths from the total number of cases?
No.
And then finally, when we give our daily statistics on COVID-19 cases, does the county where the case was counted mean the county of residence of the infected person or where they're being treated?
It would be the county of residence. And that's why occasionally, actually, the county might change because we might find out after further investigation that they might have been hospitalized in one county, but their true residence is in another. We've even had some occasional cases where actually they were from another state. They would count towards that state. That's the way the CDC does the statistics, and we comply with that.
We have a question from WGAL about community spread. Are we now seeing sustained spread across the state or in specific areas?
We are seeing sustained community spread, particularly in the southeast. The counties that have been asked for the included in the stay-at-home order, and in Allegheny County. We are not seeing sustained community spread in many other counties, which is why they're not included at this time in the stay-at-home order.
And then from the Lilith Daily News, what's the last request you made to the federal government on behalf of the citizens of Pennsylvania, and what was the federal response?
So the last request was for N95 masks and for personal protective equipment, and we have received that material from the National Stockpile.
And then a question from WPXI, are nursing home personnel or other medical personnel in a separate queue in terms of testing or just processed in the same bin as everyone else? If so, why shouldn't medical personnel be given priority?
Well, so there is a different queue. So it's critical for medical personnel, including long-term care living personnel with symptoms, to be tested right away because then we would have to quarantine all their contacts within a hospital, health system, or nursing home and patients that they might have seen. So they would be considered priority patients because of the consequence if one of them is positive.
From the Tribune Review, what are the criteria the department has asked dentists to meet in order to perform emergency procedures?
So we had put out dental guidelines, which were consistent with the CDC guidelines. There were challenges associated with that, and we heard from many dentists, the Dental Association, and dental schools about those challenges. There is actually a meeting going on this afternoon, an internal meeting to discuss that, and then a call with the Dental Association and some of the dental schools tomorrow to discuss the dental standards of care and determine the right way forward.
And then from the PLS reporter, have there been any discussions involving the state into reopening Hahnemann Hospital in Philadelphia, among other options to increase capacity?
So there are discussions about potentially opening up other spaces that have closed to serve the healthcare needs, as we've been discussing, in terms of the whole continuum of care. Again, outside of a currently functioning hospital, that would be more subacute patients. The Hahnemann Hospital, I think, would be unlikely. I think that it has been empty for 6 months. I think it would be really challenging to stand up a facility such as Hahnemann. We'll see what the Health Commissioner of Philadelphia, Dr. Farley, wants to do, but I think that would be really unlikely given the state of the facility.
From WLVR, yesterday, Dr. Levine, you said it was wonderful that people were sewing masks at home. They aren't the masks that hospitals need, but hospitals in the state are asking for people to sew masks and donate fabric. Can you clarify the confusing message?
So it depends on what those masks would be used for. So what I meant was that for personnel that are directly caring for patients with COVID-19, those are not the right masks. We need to use those N95 masks. And again, we have just received masks from the federal government, which we'll be putting out to healthcare facilities. There's a standard way that healthcare facilities, through the healthcare coalitions, which are in all these areas, and the hospital association, ask for resources, and then we will respond. In terms of sewing other masks, they're not super effective in protecting people, but I guess it's better than nothing. But I think that it's really important that people not become complacent, that they not have a false sense of security, that they might have a homemade mask on, thus they are not susceptible to contracting COVID-19 and they go out and about. We want people to stay home.
Secretary, from WLVR as a follow-up, Easton Hospital says it needs $40 million from the state or it could close its doors next week. Is the state going to provide support to keep the hospital open?
Well, we are having discussions at the highest levels of the administration about the Easton Hospital situation and how we might be able to help that facility continue to stay open, especially in these very challenging times. I don't have the specific answer yet about how that's going to be accomplished, but we are working on it.
And then a question from Fox 43 about testing, about the similarity between testing in hospital labs versus commercial labs. Are the tests basically both valuable?
Yes. So all of these tests have been approved. So whether it's our testing at our public health laboratory in Exton, whether it's hospitals and health systems testing, for instance, I know they are testing at the Hospital University of Pennsylvania, at the Children's Hospital of Philadelphia, at Geisinger Health System, at Allegheny, at UPMC. So all these excellent hospitals and health systems, if they're using their own laboratory, it's approved. And then specifically Quest and LabCorp are doing the commercial testing. All are equivalent and all are very, very accurate.
From News Talk 104.1, since rural Pennsylvania to date has had so few cases, could medical centers in those areas receive patients from other parts of the state?
If necessary, we could. We'd rather not transfer patients if it's not absolutely necessary. But if they needed to, we'll use whatever facilities and whatever spaces available to take care of patients as that surge develops.
There's a question from Penn Capital Star in terms of our testing capability at the State Health Lab. How many new tests can DOH administer and process each day? What's the current reserve of tests? And are there difficulties obtaining testing kits?
So we are testing more than 100 specimens a day. We have the right materials, chemicals, and reagents to continue testing. We do receive those from the federal government, from the FDA and CDC. And at times we've had challenges, as many other state laboratories request supplies, but we've always gotten them when we need them.
From Lehigh Valley Live, have there been any cases reported in nursing homes?
There have been cases reported in nursing homes. We're not going over the specific facility, but our health department, as well as county municipal health departments, have been assisting in those cases.
And then a couple of questions about thresholds for a statewide stay-at-home order. What is the threshold for that? and how would it be issued?
So if the Department of Health, myself, the senior staff, the governor, in discussion with the local authorities, have evidence of community spread, are concerned about the increases of COVID-19 in their area, then the governor would make a determination in consultation with local authorities whether to issue that order.
A couple of questions regarding federal authority. From WFMZ, does the president have any authority over state government when it comes to pulling back on restrictions? Are you concerned he might try to? From a public health perspective, we would not pull back from restrictions at this time. You can see what the challenges that we've had in New York. Certainly, this immense challenges that have occurred in Italy with the surge of patients and the strain on the healthcare system. And so we have really a three-pronged strategy: that mitigation, that prevention, with those separation orders that we've had, stay-at-home orders, closure of schools, and then our testing, and then our increase in healthcare capacity to deal with the surge. It is far too early to change those prevention and mitigation orders. I'm not an attorney, so I'll leave it to attorneys and other people to decide the federal versus state regulations. But we firmly believe in public health that social distancing is key, and that's why our request is that people please stay home. And then as a follow-up to that from News Talk 104.1, President Trump has said that he believes the country should be back to work by Easter. Do you share this optimism as PA case numbers continue to rise on a daily basis?
We'll see if the numbers continue to rise, but there is every reason to believe that this increase will continue and rise exponentially. We are hopeful that the mitigation and prevention efforts that we've been implementing will help to cut off that peak so the surge is not quite as high. It's hard for me to predict a month out, so we're going to take this day by day and week by week.
A couple of questions on the materials in terms of ventilators and PPE and masks. How much have we received from the federal government, and how will it be allocated?
So we have received personal protective equipment and masks from the federal government, from their stores. They are allocated according to regional needs, county needs, and health system and hospital needs. So as long as we have supplies, we'll be continuing to put those out and provide the resources that hospitals and health systems need to take care of patients with COVID-19.
In terms of our stay-at-home policy, we've had multiple reports, this is from the Record Herald, of non-life-sustaining businesses closing, but asking their employees to work from home, but meet with clients in public places. So they're working from home, but meeting with their clients in public places. We've also heard of restaurants who are failing to prohibit workers who have traveled or may have been exposed and are exhibiting symptoms from a cold from working. How could this be reported, and can you remind us what concerned or affected workers should do to ensure their concerns are addressed? Mm-hmm.
So especially in the counties that the governor has delineated in a stay-at-home order, we would not recommend that people visit clients person to person. We want people to stay home, and it's fine to telework using whatever technology they have, but we wouldn't want people to meet. Certainly, if anyone that works in a restaurant or in food preparation is sick, they should stay home, and they should not be working. Actually, that's not different than before COVID-19. We don't want sick people preparing food.
From PA Post, State Representative Torrin Ecker is asking the governor to add construction to the life-sustaining list and says that the jobs are mainly open air and very low risk of spreading coronavirus. What's your response, and is the administration considering any expansion of construction that's allowed?
So personally, I am focusing on our public health response as we've been describing it. And I know there's a whole other part of the administration, particularly the Department of Community and Economic Development, that has been working on the business closures and the waivers. And so I'll leave it to them to answer that question. As
a follow-up, PA Post would like to know, some gun shop owners and gun owners say gun shops should be included in the life-sustaining list because people buy guns for personal protection. Why should they be included in the non-life-sustaining list?
So I'm going to provide the same answer. I'm not really part of developing the list and the waiver process, so I would leave that to the Department of Community and Economic Development to answer.
And then, Secretary, our last question that we have time for today from the morning call, can you clarify the interplay between the stay-at-home order and the non-life-sustaining business order? Someone works for an approved non-life-sustaining business but lives in a stay-at-home county. Can that person leave home to go to and from work?
So they're a little bit separate. So the idea was to go in a sequential way to increase social distancing to prevent the spread or mitigate the spread of COVID-19. So first was the schools, then it was non-life-sustaining businesses, and now it's individual people and families to stay at home. If someone is working in a life-sustaining business, then they can go to that job. But we want people, especially in those counties that have been outlined by the governor, to please stay home, practice rigid and extensive social distancing to protect themselves, protect their family, and to protect their community.
Thank you, Secretary. That concludes our question and answer for today. For reporters that we were not able to get to, the Department of Health and the Governor's Office will follow up with you directly. Please stay tuned for our next briefing tomorrow at 2 o'clock. Thank you.